Good afternoon, viewers, and welcome to Health 360. I'm your host, Alicia Martin. Joining me today is Dr. Narayan Singh, and he's a gynecologist attached to the Georgetown Public Hospital in cooperation, Ministry of Public Health. Welcome, Dr. Singh.
Welcome, Ms. Martin, and thank you for having me on your program today.
Thanks for being here. You're no stranger to the Health 360 program. Today, we'll be talking about family planning and you. We'll be giving you all the information you need on family planning and how you can access those services even during this pandemic season. So, Dr. Singh, before we get into family planning, could you tell us a little bit about your department and what you guys do there?
Okay, I'm basically attached to the OBGYN department, the Department of Obstetrics. People know it as the maternity department. And so what we do there is do obstetric work, do deliveries, and look at complication of pregnancy. And then there's also the other aspect of the gynecology department, which we look at gynecological issues and so on. And one of the aspects of gynecology is family planning. So at the hospital, we do have a special clinic known as the Family Planning Clinic. And this is basically where we promote contraception and family planning. We also provide termination of pregnancy services at that clinic. And this is something that has started over the last 3 years, a specialized clinic that focuses on family planning. And so that is one of the things that we have been providing over the last 3 years.
Great. So for those persons who are watching the program and they're wondering why is family planning important, could you tell us a little bit about that? Why should persons actually use family planning, the methods?
Okay, when we talk about family planning, we really basically referring that we know that every woman of reproductive age, and that's patients, women of between the age of 15 and 45, there's has the ability to become pregnant. And one of the things what we want to do is every woman has the ability or the choice to determine, how much children she have, when she have them, and with whom, and at what time she have them. And that's what we call our sexual and reproductive rights. But we also know that spacing our children, the time we have a inadequate spacing between the children we have is also important. And also the number of children they get during their lifetime is also important. So there are periods of time when you don't want to have too many children and don't get them too frequently, and so that's why that's the need of the requirements of family planning. So it gives them the ability to choose when they get pregnant and when the methods they can use to prevent pregnancy if they want. So what we do is actually family planning is one of the purpose of family planning is to prevent unplanned or what we call unintended pregnancies. So that when people do become pregnant, it is a wanted pregnancy, it's a planned pregnancy. And one of the thing about that we know that many women will become pregnant. It's estimated that half the women who become of about almost 42 to 45% of the women who become pregnant actually is having an unplanned pregnancy at that time. They didn't plan to get pregnant at that time. And about half of those women would actually seek an abortion or what would request to have an abortion done. We know that this is not always available or not always accessible. Many of them, would actually go and have an abortion done by some clandestine method, and then they end up in the hospital because of complication. Some of them do have successful abortion done, but the plan is not to have an abortion done and use it as a family planning method. So we wanted to prevent these unplanned pregnancies so women can plan their pregnancy so that and during the time when they want to prevent pregnancy, they can use a very safe contraception or a contraceptive method and until they decide when they want to become pregnant. And so that's the whole purpose of family planning services. It's not about just contraception alone, but it's also about providing information and giving them the woman advice on how methods she can use, the benefits of delaying a pregnancy, or planning and having a small family or a family that's a size of family that she can choose. Because we know that too much having too many children, the economic aspect of it is one thing. Then having pregnancy too frequently or too early in life, and so can also have socioeconomic fallout for the mother and the child. We know that a family of five versus a family of three, the parents are better able to care for them and so on, and not also for the benefits of the child, but also for the health benefits of the mother. Having pregnancy too frequently can has tremendous effect on the health of the mother, and also can lead to severe morbidity later on in our lives. So that's why family planning is important. And so there's just some few benefits of family planning for women that it is expected that we wanted that every woman should have access to family planning services. And that's one thing that we wanted to promote, that every woman of reproductive age should have reliable access to family planning services so that she can plan and plan her pregnancies and space them out appropriately.
Definitely. What are some of the types of family planning?
Well, there are several contraceptive method, what we call contraceptive methods, as available around the world. But the ones that we have that in Guyana that are presently available, we have the what we call the hormonal method, and these include things like the 3 months injection. People know that the depot injection. We have the oral contraceptive pill that is available. We have the uterine device, or the copper T. A lot of people know it as a 5 year. And then we have the latest one that was implemented over the last 3 years, the implant, the hormonal implant. We also have things like condoms, which can be used. This is a family planning method also. And then we have then the other methods for patients who cannot use family planning methods or anything, or who, because of their religious belief, they have the natural family planning methods, which are there, which we can basically behavioral changes methods that you can do to prevent pregnancy. So those are the ones that we have available in Guyana. And then we have the permanent methods. Those are methods that I mentioned before are usually temporary methods. They're all reversible. The permanent method include things like sterilization, female sterilization, where you can do. People call it. We do the we tie the we cut the tubes. That's a surgical procedure. And for the males, we have the vasectomy. So those are permanent methods, but those are the methods that we have available in Guyana. But the methods that we have varies in terms of effectiveness and also safety, because not every method is suited for everybody can use the same method, because they have different side effects and so on. And so that's why when choosing a method, it is important that you have a consultation done with your healthcare provider, and so they can sit with you and work with you to choose and help you choose a method that is best suited for you.
Yes. So, which method would you say is frequently used in Guyana?
In Guyana, we have three methods. We have the pills, we have the injection, and the 3 months injection, the depot injection, and then we have the IUD. Those are the top three methods that are widely used. And recently, we see with the launching of the implant, there's been a fairly high request for the use of the implant. So those are the four methods that is really highly used. And then, well, we have patients who do use condoms, right? The other method, female sterilization, there's a request for it, but those are people who want permanent methods. But one of the problem with the female sterilization is that because of the need for operating theater and theater time, it's not widely available, and so it's kind of limited. Vasectomy in Guyana is not so well accepted among the male population. This is not only a problem with Guyana, but among the Caribbean and most Latin American people, that it is not used as a frequent method of contraception among the population. But it's available; it can be done. But those are the top three, four methods that is available right now and most widely used.
Okay, there are persons who may have concerns about using contraceptives because they may fear not being able to probably make a child when they do decide to have one. So, what would be your advice to those persons?
Okay, as I mentioned before, that every method have it's like there are no methods that we would use except the natural method that don't have some kind of side effects. And again, not every method is suited for everybody, for every that is suited for every woman. There are certain methods, especially hormonal methods. Women with certain medical condition cannot use those methods because of the medical condition they have. All the methods we have, and there's several, when we're looking for choosing a contraceptive method, there's several things that we look at. One is safety, how safe it is to use the method, how effective is the method is, and again, side effects. Because those are three important factors that will determine the choice of the method for the person. And that's why we would say that the methods, when you choose a method, you need to sit down with a healthcare provider and who could provide those information on the benefits and the side effects and which one suited you most. Again, most of the methods are all the methods are all safe. They're all safe. There's no like that, and they're all reversible except the permanent methods, which we call the female sterilization. They're all safe and they're all reversible. That's why we call them the reversible methods. Some of them are short acting, like the pill. You can use them on a month-to-month basis, and you could stop them right away, and you could be back pregnant. Then we have the long-acting methods, include things like the copper T and the injection and the implant, which acts for sometimes 3 to 5 years, as long, and then the copper IUD can go for as long as 12 years. But they're all reversible. Once they're removed, they're reversible. So all the methods are reversible. This is always a fear among women that if they might start using a method and then when they try to discontinue the method, they want to get pregnant, they might not get pregnant. So all those methods are reversible, and there should be no fear that well you can't get back pregnant unless they have some other medical complication or some other condition that's preventing them to get not to get pregnant.
So I heard you mention just now about the natural family planning method. For those persons who are watching and wondering how does that work, could you tell us about it?
The natural family planning methods are basically based on behavioral changes. These are methods that do not use a drug or a medication or a device or so on. And so they're based on behavioral change. And there are certain sect of people in the community or in our system that who would not want to use a method because of their religious beliefs or even because of a medical condition they have. They can't use a hormonal method or another method, and they might have to resort to natural method. And this is based on the fact that, if in a woman reproductive cycle, sometimes at the mid-cycle, she would produce an egg and then she would get pregnant. The whole idea behind the natural method is to prevent fertilization during the time when she ovulates. So it can vary from the form of abstinence during a specific time of the menstrual cycle, which we call the abstinence method, so they have to time their cycle well and abstain from sexual intercourse or use a protective barrier during the period of time when they're more likely to get pregnant, which we call the fertile period. Or sometimes some women, and those are the methods. And that's several methods they can use to determine when they ovulate. Some people can use temperature, they can use a change in the mucus or the discharge from the vagina. They can check it to see if they have certain consistency at the time when they ovulate. They can use a temperature method to determine, or they can use just a time cycle, depends upon how regular periods are. The thing about the natural methods, though, because it calls for a lot of motivation on behalf of the couple, and it calls for somebody who's educated and who's motivated, and it also depends upon how regular their cycle are. And so these methods, even though they're used, the failure rate is kind of fairly high. Somewhere in between the 20 to 30% of those methods sometimes fail in a year. And that's why they're now so widely used, but they're available, and it's something we can teach people on to use. But again, there's also the natural method is known as a withdrawal method, which is practiced by many couples. That's a natural method again. At the time of ejaculation, the male partner would withdraw and then ejaculate outside, and they can prevent pregnancy. But again, these are methods that are available, but they're not so effective. It's not one of the top effective methods. But for those who cannot use our method, those are the ones that we can tell people about.
Okay,
So that's for the natural.
the natural methods? What are the health benefits of oral contraceptives?
Well, like unlike one of the benefits of contraceptives is to prevent pregnancy and how effective it is. But for example, the oral contraceptives also, other than providing contraceptive benefit, which is about 98% effective if used well, They can prevent a pregnancy about 98% of the time. That means that if we have 100 couples who are using the method as they should, 98% of them would have would not have a pregnancy, and that's a good, we a fairly good effective method. But besides of there are also other benefits because these are hormonal medications, and they also have non other benefits to them. For example, when people who are on the oral contraceptive, they can and they have irregular menstruation, it can help regulate their menstruation, so it can they get regular cycles. There are certain people with certain hormonal dysfunction who have very irregular cycles and so on, and so it can be used as a method for regulating the cycles also. So they have the benefit of having a regular cycle. Patients who use oral contraceptive also get lesser bleeding. The amount of menstrual flow is usually lighter than, especially persons who might have heavier flow. We can put them on the oral contraceptive, and we also sometimes use it for treatment of patients with heavy menstruation, and it also have contraceptive benefits. So lighter blood flow means you're losing less blood per month, and prevention of what we call anemia, because one of the contribution causes of anemia is like people who have heavy menstrual period, and over a period of time with heavy menstruation, you can become anemic, and so heavy menstruation, it can reduce the flow. This is especially useful in teenagers, especially those who have who might be having, initially when they first start in the first 2 to 3 years, having their first menstruation, they can have irregular cycles and heavy cycles. And then we know teenagers also, because of their diet and their lifestyle, they might not be taking adequate iron supplements. And so using an OCP at the time, what we call the oral contraceptive, can prevent anemia, them developing anemia. There are also other medicine, other benefits. For example, there's a group of patients who have during menstruation can suffer from severe menstrual cramp, something we refer to as dysmenorrhea. And patients who use oral contraceptive, we could actually reduce the amount of cramping they have at the time of menstruation. Some patients come have to stay home, take leave for stay home for 2 to 3 days because of menstrual cramping. The use of the oral pill can actually reduce the amount of cramping they have. It is also used in the treatment of certain medical condition known as endometriosis and so on, and regulating. But those are some of the basic benefits of having the non-contraceptive benefit of using oral contraceptive pill.
Yes, talking about these services, how can persons benefit from these family planning services offered at GPHC during this pandemic season? I know we're practicing social distancing and we're trying to stay in a lot, but how can persons still benefit from these services?
Well, it's not only the GPHC, but it's in the public health system. Family planning services is available at all, it should be available at all, at the lowest level, even at the health post level, through the whole country. But it depends, again, depends upon the region and so, because of accessibility and so on. And so even at the lowest level, even at the health, the what we call a community health level, the community health workers, some of them are trained to provide, like just provide some level of family planning services. But it's done at most of the health centers. It's available at most of the health centers. Again, we do have some issues with accessibility and sometimes availability of the methods. Sometimes we do have stockouts and so on, and we hope that with time some of these issues can be sorted out. With the COVID pandemic, and this is not only unique to Guyana. Many of the countries around the world have, have some of the essential services that were being provided on a regular basis have had to take back seat, and just like family planning services have had to be as the services have had to be curtailed because of the effect of the pandemic. One, the lockdown, the use of medical staff for other purposes. Then the fear of people coming. A lot of people were fearful of going to the health facility, because of getting an infection, the lack of transportation, availability of transportation. So many of these factors contributed to the reduction of uptake of family planning services. And this is something we have seen in many of the clinics. But we know that COVID is not going to go away for a while. It's going to be with us, and so we have to adjust. And so some of the centers now are starting to like having providing specific days, or even they can call in. So we start looking at innovative ways to how women can come. We are actually doing what we call scheduling. You could come and get a call, get an appointment, so you come, so we don't have an overcrowding In the past, many of the health services are like we had one specific day per week for family planning. So you have a bunch of women gathering up at the clinic for one, for a half day clinic. Now we can do more innovation. We can like spread out the clinic, book by appointment, give them time in when they can come. So those are things that we have to do with time. We know that this is even the WHO recommended that maternal and child health services, which include family planning, should not. We should start looking at ways of how we can continue to provide these services because they are essential services and they need to be provided. At the Georgetown Hospital, we still provide family planning services, again, but at a reduced level. So you have to come and you probably get an appointment. Depends upon the days where you come. We don't want to overcrowd in, but the services are still being provided on a daily basis. If you come and sometimes we are booked up, well, we will get an appointment for another day. But not only the GPHC, but you should check with your district health centers. They all provide family planning services. I know with the COVID, many of the services was a kind of bit curtailed, but we hope that with now that with the new with the knowing that COVID is going to be with us, we have to start planning how we can live with this situation. And so we hope that the services will start being provided on a wider scale, back to its normal level.
Definitely. What safety measures are in place at not only GPHC but the health centers to ensure that persons access these service safely?
Well, as again, one in terms of accessing the services, and this is not only for family planning service, but anybody who come in to access services at all the public health facilities is recommended that they be screened, right? That they're screened on entering the compound or the facility, so they will have a temperature check done. They were expected to wear masks. We will do ask them to wash their hands at the time when they come into to the clinic. And then once they're in the clinic itself, we do the distances. We avoid patients not that's we don't want to overcrowd them. Not more than 5 or 10 patients, depends upon the space you have um, in the waiting room. And then the doctor and the we have also increased, like for example, the consultation. We have the close between the thing, increase the distance between the patient and the doctor. The doctor would be wearing a mask, the patient is wearing a mask, and they're at least 6 feet apart. So that those are some of the basic safety measures that we are including with regards to the COVID, so that they can still access the service, but with some changes to keep everybody safe, both the healthcare provider and also the patients at the same time, and also to prevent other patients who are coming to the facility from contracting or getting infected should there be any cases like that. So we're hoping that the health centers, these facilities implement these measures that has been sent out to them, and we want to ask patients, members of the public, to be patient because this is going to be the new norm. And don't feel that when you come, you have to go through all this process. I'm not going to the facility because you got to go through all this thing and they got to check your name and I know and that discouraged initially. I know when big things happening and when changes happen, people are usually reluctant at first to undergo changes. But it is something that is going to be with us, and we all have to change. And so don't delay it or put off an appointment at your family planning clinic because of the COVID, or wait until the COVID done. Because whilst waiting, you might end up getting pregnant and having an unplanned pregnancy. So that's what the methods are. Those are the measures we are putting to ensure that patients are safe and that they can still access the service.
Thank you, Dr. Noran Singh, for joining us in the program today. I am sure that the public would have received quite a lot of information, and I do hope that you guys access the services that are available to you. This is where we say goodbye for now. Thank you for joining us in Health 360. Goodbye for now, Guyana. Stay safe.